early age coming up in learning the craft, you tend to say, want to try out with the other team members, then say you want to take on more than what you can manage.
Intimacy with like a partner, does it affect like sexual activity?
Well, I don't have that problem. You know, in a group of people, you have to get up a way like, you know, if you get up certain way, them sisters, something really wrong with your back, you know, can't get up, but you have to just try and do fast.
In Office with Dr. Jevon Samuels.
Guys, welcome to another episode of In Office, where we talk about life, sickness and death. Today, we'll be talking about lumbar spondylosis, and here we have with us our guest here, Mr. Phillip Thorpe. Welcome to the show, sir.
Thanks for having us.
Okay, sure. Now, lumbar spondylosis is a degenerative disease of the spine, and the spine is basically divided into three different sections. So we have the section here at the neck, which is called cervical spine. We have the chest region, which is called the thoracic spine, and the abdominal aspect of the back is called the lumbar spine. So today we'll be focused on lumbar spondylosis, or in layman term, basically arthritis of the lower back. The causes of lumbar spondylosis, it's mainly an age-related process when the bones or the vertebrae in the spine degenerate, and also the intervertebral disc in between the bones also degenerate. And some of the symptoms that persons may have, mainly lower back pain, or they might have stiffness, especially in the mornings. Right? But most of patients who have lumbar spondylosis have no symptoms whatsoever, so they don't have any pain. Now, we also have some patients that may have more severe symptoms that maybe more than just back pain. Sometimes the pain may shoot down to the bottom or down to the legs, and also they may have numbness and stiffness in the legs, and those are normally cases in which the severity of the lumbar spondylosis start to affect the spinal cord, and as well as the nerve that run from the spinal cord to the legs. The treatment first, we normally have a symptomatic relief first. So in terms of the pain, we normally use, patient can start with over-the-counter medication such as probably Panadol and Brufen. Some patients may need stronger analgesics such as stronger NSAIDs such as Voltaren, Cataflam, etc. While in some cases, physiotherapy may be the mainstay of treatment without the analgesics. And in real complicated cases in which we have numbness, weakness in the limbs, or we may have bladder or bowel symptoms, then normally the patient would need surgical treatment. Now, our guest here, Mr. Phillip Thorpe. How long ago did you start have the symptoms? The lower back pain was your primary symptom?
I could say, first let me introduce myself once more. I'm a transmission specialist for the better part of 20 years.
Yes.
And you know, over time, heavy lifting gradually break down the bodies, but the better part of 7 years, I've been feeling on and off back pain.
Lower back pain. Okay, so how severe is this lower back pain? Does it prevent you from sleep, or just a nagging pain that you have throughout the day?
Well, I wouldn't say throughout the day, it's just a nagging pain, but from time to time, usually if I do a compilation of work and tends to lift things frequently, most times load that is heavier than I should be lifting without support of somebody else, well, it tends to just nag you, so you will get like Panadol, Cataflam, whatever the case may be, I cool it down for a cold.
Okay. And what about the stiffness? Do you have stiffness as well in the lower back, like you can't move the lower back properly? sometimes?
Yes, even when you're sitting down for a moment, so like half an hour to an hour, sit down. When it tends to get up now, your back to stiff up on you, so you have to get up in a lunge way and then take time straight now.
Okay, and like how this process normally take like minutes or over hours for you to stand up normal and or
Minutes.
minutes?
Yeah.
Okay. And so apart from the lower back pain and the stiffness, you have no other complaints?
No, not presently. It's just, as we said, lay down on your back for a moment and tends to get up without a pillow on the head. You might have a little difficulty, probably in the morning, if you really just get up like that. You feel a lower pain in your back, but I don't have any foot problems.
Okay. So you didn't, no numbness in the legs, no issue
no
with the
issues.
urine, no issues with the stool,
No.
passing stool. Okay. Any family member like sibling have similar issues?
No.
No family member have similar issues. Okay.
But
And
I have friends in the same transmission field as I am, having the same issues.
okay.
So I don't know if I can link it to the industrial part of the work where, you know, you always the bending over and, you know, in a transmission field you have to keep standing. If you have a good look a while and bending, standing.
Okay. And then the diet as well. So do you normally have a balanced diet, like you eat calcium source like milk or cheese or so forth?
Yes, I eat those stuff, but you know, generally, as I can say, mechanic, transmission repair, we tend to miss the meal because the customers on us, but you know, when I do get conscious, I try to have a balanced diet.
Alright. Also, in terms of how it affects the social life, I know you mentioned about like if you're out and you probably sit and you should sit for a while and then you should get up and feel stiff. But what about in terms of intimacy with like a partner? Does it affect like sexual activity?
Well, I don't have that problem.
Oh, so it doesn't affect your sex life any at
I
all?
don't feel no pain at all in
No
that
pain.
kind of position.
Okay. Alright, so it doesn't affect sex any at all. Alright. And in terms of how you were diagnosed, do you can remember like the test you need to do an X-ray, CT, MRI?
Yeah, well, I do an X-ray first, and then it'll have a look inconclusive. I want a further outline of what is going on. So do an MRI after.
MRI. Alright, and then is it?
Yeah.
Sorry, over talking. What is the MRI that they diagnose the lumbar spondylosis?
Yeah, MRI.
Okay. So you were referred to a specialist, orthopedic surgeon, and those are normally the persons who get severe symptoms. We normally send to orthopedic specialists.
Yeah, man. I was referred to an orthopedic surgeon
Alright.
to look into the matter.
Okay. And what about physiotherapy? I know that some persons also get referred to physiotherapists.
Well, I don't go to that level yet to know if it's a physio. Well, basically, pertaining to my symptoms, it might lead me to a physio, kind of so extreme yet. But further on, I can come back on the podcast and explain.
So no surgical treatment was offered to you at this time. It don't reach
No.
that stage yet. They don't really have much symptoms. They only have the back pain, and it's not very frequent.
Yeah, and it's not constant. Yeah, so.
Alright. So what are some of the things that you do that worsen this back pain? I know that you mentioned that you lift transmissions a lot.
Yeah, cause in my early age coming up in learning the craft, you tend to say, want to try out with the other team members, then say you want to take on more than what you can manage in terms of doing it. And you know, you have to try one, learn it fast. Because the faster you learn, you get to earn. So over a period of time, you find yourself at work alone. So you drop out the transmission, you want to pull it up, you want to lift it up. So it's just a period of time, you know, your body going to break down still. So probably that is costing now as of the result of the bad management to the load lifting.
Okay. How it affects productivity? It doesn't affect your job itself in any means, such as does it, like, if you miss a day or two from work, or it normally don't affect you that?
It don't affect me that I miss a day. The only real embarrassment sometimes, if you're out like and you sit down, you know, in a group of people, you have to get up away, like, you know, if you get up certain way, them sister, something really wrong with him back, you know, can't get up, but you have to just try and be fast.
Okay.
And the next thing now, I don't know, I can't call that a symptom still, but the pain,
Yes. About it.
if like you sneeze, you get it, you feel it mostly like, you know, cold time I come and, you know, when the sneeze come up or something dusty come in, you know, you will feel it down there, so you know, you need a painkiller.
Okay. Alright. So, as I said before, it probably the transmission that you lift in is, there are certain techniques, that is why it would be good to learn like the technique to lift heavy weight, and also ask for help as often as possible, because it's a degenerative condition which it's gradually going to get worse with age, and you already have the risk factor in terms of you're constantly lifting heavy stuff every day. So at least to learn the techniques or to get assistance would go a long way in preventing your condition from getting worse. Alright?
Well, I would say not really a technique, but ask for other help, because you have a load where it's heavy for one person, but it's light for two persons.
Yes.
So you know, say, wait on the help, ask for the help. But you know, more time we ignore man, because we just want to do it and we don't see nobody, and so I just ask for the help. So you know, have a special technique, you just need to get more help. So if two man can lift it, they get through.
Okay. Alright, so do you have any last words you want to say to the public? I can give you 1 minute to advertise the transmission business, since you don't really need it, not costing you don't need any assistance. So 1 minute, Mr. Thorpe, you can advertise the transmission business, and then I'll make one final comment.
Well, as I said, this is Phillip Thorpe, otherwise known as Marvin, from Marvin Transmission and Auto Repair Limited. 8 Stuart and Crescent, Kingston 10.
Okay,
But you can come and check out with us, and I can tell you, take help with load lifting, because it will cost you.
Alright, thank you very much, Mr. Thorpe. So viewers, please remember to like, share, subscribe, and leave a comment. Until next episode, keep safe.
Be sure to subscribe for more informative contents on life, sickness, and death.